Recognising the early symptoms of breast cancer can be the difference between life and death. Early screening is vital, but now it's been revealed that more than 2/3 of women in parts of Manchester are missing out on the national target. Through the Nightingale Centre here at Wythenshawe Hospital, nearly 60,000 women will be screened this year for preventative measures. For women between the ages of 50 and 70, it's vitally important that they're screened once every 3 years. But now a backlog means those women could be waiting longer. Health bosses put the problem down to a shortage of radiographers to carry out the screening, and they say they've launched an emergency plan to tackle the situation and say things are improving. But one breast cancer campaigner says it's the NHS cutting corners once again.
Well, it's like a lot of things in the NHS that things come round again, and we have been in this situation before with the shortage of radiographers for the routine breast screening, which is when women are called when they're 50. And I think it is quite awkward because you're supposed to be called on your 50th birthday, but if it's 3 months, 6 months late, and then you call back every 3 years, I don't think people always realise if they are being called late. And of course it is so important because you know, if you're 3 months late, you could be much further advanced with breast cancer than if you're called when you should be.
The Nightingale Centre, which runs one of the biggest screening programmes in the country, admitted there were problems. A statement read, "We had a problem caused by a national staff shortage, but since April we have been fully staffed and everyone has worked incredibly hard, which means we expect to be back on track by the end of summer." A woman who screened early has almost a 50% chance of survival, but now a shortage of staff to carry out the screening is putting too many lives at risk. Beverly Walkden for Channel M News.